When it's time to start a medication for cholesterol, the first line medication is a statin. The statin can reduce the bad cholesterol LDL almost 50%. However, in a good number of patients, a statin alone won't do it. So once we have a patient on a statin, as well as have made significant lifestyle modifications, we look to second-line medications. And there are two classes. One is medication that will block reabsorption of cholesterol, and the other is one that will bind bile acids as they're leaving into the intestine, both of which will decrease the cholesterol level and can be used in concert with the statin the patient's already on. Beyond the two other classes, a newer medication called a PCSK9 inhibitor is being used to lower cholesterol. A PCSK9 inhibitor is an injection that gets given every 2 to 4 weeks by the patient to themselves. And this medication can reduce cholesterol by over 60%. They get used with statin medications and can reduce the LDL by an additional 13 to 20%.
Another non-statin medication called bempedoic acid received FDA approval in 2020. It is especially helpful for treating a type of high cholesterol that runs in families, and it works by blocking the production of cholesterol.
The non-statin cholesterol medications can be used as monotherapy, meaning be used alone, or be used in most cases with statins as an additive therapy. Our goal in treating cholesterol is to get it as low as possible based on the patient's individual risk. So it's not uncommon to use two medications together to optimize somebody's health. Beyond the LDL, which is usually our first line of attack in reducing cholesterol, there are other medication classes that can specifically benefit the HDL and triglycerides. We know that we have several medications that can be used, and we are often changing medication to medication. It's important when a patient is frustrated with their progression and their treatment that they have an open line of communication with their doctor.